Staying on labor matters, the Nigerian Medical Association, NMA, has issued a 21-day ultimatum to the federal government demanding the withdrawal of a recently released circular by the National Salaries, Incomes and Wages Commission. While describing the content as a potential threat to Nigeria's fragile healthcare system, the Kwara State Chairman of the NMA, Professor Abdulrahman Olushola Afolabi, presented a 19-point demand urging the federal government to address doctors' welfare. The association accused the NSIWC of acting in bad faith and violating long-standing collective bargaining agreements signed in 2001, 2009, and 2014. The NMA has consequently proposed the establishment of an independent salary and welfare commission for healthcare professionals to ensure that policies reflect both economic realities and the unique needs of the sector. For some perspective, we're joined now by Professor Bala Audu. He is the president of the Nigerian Medical Association, NMA. Thank you very much for giving us your time. I know it's been really a busy day for you. Talk to us really about the concerns that are being raised. New salary structure proposed by the federal government for medical doctors is being described as a potential threat to Nigeria's already fragile healthcare system. Please simplify this in layman's terms. Why is it being described in such dire terms?
Good evening, and thank you for having me. The issue arose from a circular released by the National Salaries, Incomes and Wages Commission, which was supposed to address allowances paid to Nigerian doctors based on application of our basic salaries that arose from agreements in 2001, 2009, and 2014, but in which the National Salaries, Income and Wages Commission failed to address these inputs from these agreements. Having noticed this, the Nigerian Medical Association called the attention of the National Salaries, Incomes and Wages Commission, pointing out where these errors are. Unfortunately, instead of addressing these errors, the National Salaries, Incomes and Wages Commission issued a unilateral circular that did not just fail to address these issues, it went ahead to even erode some benefits that Nigerian doctors hitherto enjoyed. This is all happening in an environment where the Japa syndrome has had a significant impact on our healthcare delivery system, with very few doctors remaining in the country to still cater for the quality healthcare of the teeming population of the citizens of this country. We have since communicated to them our complaints and our rejection of this circular, and have urged them to sit with the Nigerian Medical Association to address these issues so that we can come to a common ground. Nigerian doctors are not asking for anything new. They're simply asking for an application of what has already been agreed between government and Nigerian doctors.
All right, we know the issue is dragging and continues to be, contentious between you and the federal government. But how feasible is the NMA's proposal for the establishment of an independent salary and welfare commission for healthcare workers to ensure that policies reflect both economic realities and the unique needs of the sector?
The federal government already has an existing policy on health workforce retention. And amongst the issues that center around health workforce retention are an array of issues, but let me concentrate on this commission we're talking about. This is a proposal. It's an option. It's a situation where we produce a proposal, sit with the side of government, and take a decision collectively that will benefit the Nigerian health sector and ensure there is significant retention of the health workforce to deliver services to the citizens of this country like we continue to deliver and that we dedicated our lives to deliver.
All right, let's talk about the ultimatum that you have given. The Lagos State NMA described it as not an act of confrontation, but a call for urgent dialogue and correction. What happens after the 21-day ultimatum elapses?
We're looking at a situation where government has already approached the Nigerian Medical Association. We had very robust conversations at various levels of government across all the issues we have raised. The proactive nature of the Nigerian Medical Association, its advocacy, and its ability to produce options and negotiate with government is so robust that we believe the situation is one that can be negotiated between the association and the government to the benefit of the Nigerian citizens and thereby averting any situation of industrial action.
Okay, let's talk about some of the demands that are being made by the NMA. They include the payment of medical residency training fund for 2025. You also want the implementation of the specialist and hazard allowances and the universal application of the Conmer's salary structure across all government institutions. I want to ask, though, are there priority areas on this list of demands, or it all has to happen before you can listen to the government?
If you look at our demands, there's really nothing about a priority area. These are basic and fundamental issues. All of these issues have actually been approved by the President of the Federal Republic of Nigeria. It's only about implementation. So what we are doing is to ensure a robust enough advocacy and the engagement of government to enable the key players play their own role in carrying out what has already been approved. And let me call the attention of the general public to the fact that some of these areas we are talking about, Nigerian doctors have been patient about them, engaging government about them over the last 18 months. So doctors have been very patient. Doctors have employed diplomacy, we have employed advocacy, and we are now beginning to get response to these. And we believe these are so straightforward that government will be ready to fulfill all its obligations. There is nothing new. It's already something that government has approved and that is already agreed between us and government.
All right, I do have some more questions. Let me take this one that came up for you saying, why does it always have to come to this ultimatum? It's either you do it now or we can. If you've been engaging in dialogue and it doesn't seem to be working, what are the chances that when you issue an ultimatum like this, that they will listen? Because, I mean, we've had instances where they didn't.
Yes, what led to the ultimatum is the fact that, like I stated, some of these issues we've actually been negotiating and going to and from government over the last 18 months. However, what broke the camel's back is the recent circular issued by the National Salaries, Income and Wages Commission. And one of our primary demands is that that circular be withdrawn while we sit and negotiate the issues around them. Because the circular was issued unilaterally, there was no engagement whatsoever. And we believe that's a very simple thing to do so that we can meet each other and have a mutually respectful conversation that will benefit the citizens of this country. And in all the issues in this circular, there are issues that the government of the Federation has already approved.
All right, this quick one before we let you go. This is for us that are not in your space, and that has to do with a statement by the NMA here in Lagos. They criticized the proposed extension of specialist and honorarium allowances to health professionals who are not doctors. Could you explain this? Why is this a concern? I mean, if you get paid, why are you worried about the others? Explain it to us.
Fundamentally, we're not worried about what others are getting. Absolutely not. In fact, we're encouraging that all members of the interprofessional, multidisciplinary workforce in this country should be given what is due to theirs. And we encourage government to give more to everybody. However, the only point we're stressing is that it should be done across board. It should not isolate any particular group and leave others. And there is a well-defined relativity when this is done. And we are not in disagreement within ourselves, within the health sector. Doctors, nurses, all other healthcare workers are on the same page in this matter. Give as much as you want to give to everybody, but maintain that relativity. Well, we are encouraging government to give other healthcare workers as well, but they should also make sure that they give in the same relativity.
Equitable distribution, basically. Thank you very much, Prof, for speaking with us. We appreciate your time, and we do hope that the government will do the needful soonest.